was frequently very sick. He was in and out of the hospital. He was in doctor visits all the time. He wasn't able to go to school. His joints were swollen. He was always in pain. He had bad diarrhea from his disease. His blood counts were always low, and he had failed every available medication that there was.
In 2004, Dr. David Tichy, a pioneer in the treatment of the rare childhood disease, autoimmune lymphoproliferative syndrome, or ALPS, had a patient in dire need. He also had a breakthrough concept at his fingertips, but the funding to bring it to life, to see it help his patients, was out of his grasp. Dr. Tichy, a clinician and researcher, sought to test the impact an existing drug might have on the crippling effects of ALPS. Denied funding from traditional sources, it was a small, targeted grant from private funders that made an enormous impact on those young lives within 24 months.
There's not many good funding mechanisms for doing projects that can be done in a short period of time and bring it to patients quickly with little preliminary data. The grant mechanism allowed us to take an idea and get a medicine to him quickly, which has made him feel a lot better. He's back in school, hasn't been hospitalized since he's been started on the medication, and he's doing tremendously better from a quality of life standpoint than he was before.
The catalysts behind Dr. Tichy's success story are George and Judy Goldman, innovators in a growing approach to funding gaps in medical research. Armed with a business sense and the will to make a difference, the Goldmans found support to cut through the clutter and turn lives around.
There's a lot of things that are very curative out there right now. They're probably adaptable to other diseases, and that was our pursuit. So right from the beginning, we were accelerating the cure. A funder can make a tremendous difference because it's only with, we believe, only with a targeted approach, both to the cure and to the disease, that we feel you can get results.
Around the country, deserving patients wait, while cures and treatments are stalled for lack of focused funding. Each has a story of courage and determination. Andrew Slaw has familial dysautonomia, FD, a degenerative and debilitating condition that takes away a normal childhood and limits the average life expectancy to the early 20s. In 2001, scientists isolated the gene that causes FD. A few years later, researchers found 2 medicines that helped improve symptoms for FD patients. The treatment had an immediate and enormous impact on Andrew's life.
I was in the hospital a lot and I was feeling icky, and half of it I could not go to school. Now I go to school every day basically.
Even with treatment, Andrew's devastating symptoms continue to surface. Lack of funds keep researchers waiting to test an existing medicine against FD that could offer Andrew and others huge benefits. The race, as always, is against time. A small, targeted grant could make it happen within 2 years.
The thrust of our focus in funding research is speed. These kids do not have time. The clock is ticking loudly, and we need to be able to offer these kids a lab-to-life supplement or some type of treatment that is going to help them quickly. They do not have the benefit of time. The research that we are hoping to fund through 2 Years to Cure's initiative should roll out quickly and benefit the children within the 2-year period.
The supplement is out there, but we don't know it. It's sitting on our shelves right now, but we don't know what this supplement is. I think once we get that money and we have that supplement, I'll feel so much better.
The success of hundreds of medical breakthroughs relies squarely on targeted philanthropy. All these patients and researchers need are generous partners with heart and vision like the Goldmans.
I feel I've lived a good life, and no one could take anything of that away from me, but there are so many children out there that had not had a chance to live yet, and their lives are about to be snuffed out.
I'm greedy. I'm a greedy mom. I love my kid unconditionally, and I have seen how these supplements have helped Andrew, but I know that it's only taken him to a certain plateau and that there's something else out there